Welcome to The Explainer. Today, we're diving into a huge question that so many people with multiple sclerosis face: starting a family. For a long time, this whole topic was just filled with uncertainty. But you know what? Today, the science tells a very different and honestly, a much more hopeful story.
So let's just get right to the heart of it. Can you have a healthy pregnancy with MS? For generations, the answer to that was kind of murky, full of doubt. But as we're about to see, decades of research have completely flipped the script, giving us a surprisingly clear and, reassuring answer.
So why is this conversation so critical? It really starts right here with this number. MS is 2 to 3 times more common in women than in men. And for more than half of those women, the disease first shows up right during their main childbearing years. So you see, this isn't some niche medical question. It's a real-life decision that thousands of people are navigating.
And for a long time, that reality was, let's be honest, pretty terrifying. Getting an MS diagnosis just threw up this wall of fear. You'd worry about passing the disease on, about what pregnancy would do to your own health, or if you'd even be able to care for a child. But here's the thing. That was then. Things have changed.
Okay, let's get into the science, because this is where it gets really fascinating. We're going to look at the surprising, almost paradoxical effect that pregnancy has on MS. Your body's own changes can be this amazing shield, but also, later on, a potential risk.
And this is the paradox right here. During pregnancy, something incredible happens. Your risk of having an MS relapse actually drops. It goes down. But then, after you deliver, the pendulum swings back. There's this rebound effect, with a 20 to 30% chance of a relapse in those first 3 months postpartum. So what in the world is going on immunologically?
Well, here's a pretty simple way to wrap your head around it. To protect the growing baby, which your body kind of sees as foreign, pregnancy signals your immune system to just stand down, call a truce. And this has an amazing side effect. It also calms down the autoimmune attack of MS. But once the baby is born, that natural suppression lifts, and the immune system can roar back to life, sometimes with a vengeance.
This brings us to what might be the single most important finding in all the research. It's a direct quote, and it's powerful. Pregnancy has no adverse long-term effect on disease progression. Let that sink in. This is the absolute game changer. Even with that temporary risk of a postpartum relapse, having a baby does not make your MS worse over the long haul. This one finding has totally reshaped modern medical advice.
So it's one thing to know the science, but how do you actually, do it? How do you navigate the real journey? Let's break down the whole timeline, from planning and conception all the way through to life after the baby arrives. You can really think of this journey in 4 key stages. It all kicks off way before you're even pregnant, with preconception planning with your whole medical team. From there, it's about managing symptoms during the pregnancy itself. Then, of course, there's the delivery. And finally, navigating that super important postpartum period with your eyes wide open. All right, let's zoom in on that first stage, because honestly, this preconception plan is everything. Success is all about being proactive. First, you assemble your team, your neurologist, your OBGYN, maybe an MS nurse. Together, you talk about your meds, what we call DMTs. The goal is to get pregnant when your MS is stable, when you're in remission. And of course, you handle all the usual stuff like stopping smoking. Okay, let's talk about the baby's health, because I know that's a huge worry for so many people. The data here is incredibly comforting. First off, the risk of your child actually inheriting MS from you is tiny, about 1 in 67. And just as important, the research is clear. Having MS does not raise the risk of miscarriage, stillbirth, or birth defects.
Now, during the pregnancy, you might feel like your old MS symptoms are getting worse. More fatigue, maybe your balance feels a little off. A lot of the time, that's just the normal strain of pregnancy piling on. The key is knowing the difference between that and a real relapse. A true relapse usually means a new symptom popping up, like optic neuritis or vision problems. If you've never had that before, that's when you pick up the phone and call your neurologist right away.
So how do you manage all these moving parts? Well, this is where your modern medical toolkit comes in. We're going to look at the medications, the different strategies, and how you and your team can make the best possible choices for you and for your baby. It used to be a hard and fast rule. Stop all MS meds before you even think about getting pregnant. But our understanding now is so much more sophisticated.
Some of the older injectable drugs are seen as pretty safe during pregnancy. And for women with really active MS, staying on certain infusions might actually be the safer bet. The big takeaway is that there's no one-size-fits-all answer anymore. It's a personal conversation with your doctors. And this quote from the research really just nails it. The risk of stopping DMTs must be discussed with patients. It's all about weighing the risks. For someone with very aggressive disease, the danger of having a major relapse if they stop their medication could be way worse than any potential risk from the treatment itself. This right here is the core of modern collaborative healthcare.
And what about after the baby is born? Here's another really fascinating piece of the puzzle: breastfeeding. Studies are finding that exclusive breastfeeding, for at least the first 2 months, seems to have this major protective effect. In some studies, it cut the risk of a postpartum relapse in half. It looks like the hormones involved in lactation just keep that immune system on stand-down mode a little bit longer.
So you put all of this together, the science, the planning, the new medication strategies, what does it all add up to? Well, it adds up to a massive shift in how we think about MS and pregnancy. The whole conversation is changed. We've moved from asking if you can start a family to focusing on how you're going to do it.
So as we wrap up, let's just lock in the biggest takeaways. Number 1, pregnancy is safe for the long-term course of MS. Number 2, careful, proactive planning is absolutely the key to a healthy outcome for everyone. Number 3, your team of doctors and nurses, they are your partners in this. And number 4, for most women with MS, the outcomes from mom and baby are the same as for everyone else.
And that really leaves us with this one final powerful thought. With everything we know now about managing the disease, about medication safety, about the power of a good plan, hasn't the question really changed? It's no longer if a woman with MS can have a family, but simply how she and her team are going to plan for it.